Hi, Mr. Scarn. How are you today?
I'm well, thank you.
My name is Lexi Rice. I'll be your nurse practitioner doing your examination today. What brings you into the office?
My knee.
Your knee?
Yeah.
Okay.
I banged my knee up
You banged your knee up. And when did this happen?
last week.
Okay, and can you point exactly where you're feeling this knee pain?
Right here.
Okay. And with your knee pain, is it constant? Is it all day? Or does it come and go?
Just comes and goes.
Okay. And how would you describe your knee pain? Is it sharp? Is it burning? Is it tingling? Achy?
It'll just be a little achy.
Achy?
Yeah.
Okay. Have you tried anything to make the pain better?
Just ice.
Ice, and does the ice help?
Yeah, it seems to for a little while.
Okay. And what makes the pain worse?
Just like when I wake up, it seems tight.
In the morning, it's the worst?
Mm-hmm.
Okay. And you pointed to where it hurts. Does it radiate up your leg, or does the pain go down your shin or the back of your leg at all?
No, down.
Down your shin?
Yeah.
Okay. And you said it hurts worse in the morning. And on a scale of 0 to 10, on average, what would you say your pain is?
Yeah, like a 5.
A 5? And are you having any other symptoms? Any weakness, numbness, tingling, headaches?
No.
No other symptoms. And what do you think is going on with your knee?
I don't know. I whacked it on a ladder pretty good, so
Okay.
it's probably just hurts.
Have you ever had any other injuries to that knee before?
Just when I was a kid. Yeah. So yes.
What was that injury before?
During football.
During football. Okay. I'm going to ask you about your medical history, so just a few questions there. With your family, this is going to be brothers, sisters, parents, and grandparents. Do you have any family medical history of cancer that you're aware of?
My dad had prostate and colon cancer.
Okay. Is he still living?
Yeah, he's alive.
And any history of hypertension or high blood pressure?
Nope.
Alcoholism?
Nope.
Asthma? Any history of asthma in the family?
Nope.
Any history of diabetes that you're aware of?
Nope.
Okay. Your mother's still living?
Yep.
Siblings are all healthy?
Yep.
Okay. Have you ever been hospitalized or treated for any psychiatric reasons?
Nope.
Have you ever been hospitalized or treated for any alcohol or drug use, related to alcohol or drug use?
Nope.
Do you have any occupational illnesses, any reasons you've been sick from your job?
No.
Okay. Do you have any chronic medical conditions that you've been diagnosed with?
Mm.
Do you have any recurring or episodic illnesses?
Nope.
Have you had any other traumatic injuries or hospitalizations?
Nope.
And what surgeries have you had?
Vasectomy.
And what year was, or how long ago was that? Do you remember?
A long time ago. So my son's 14, so 14 years ago.
Okay. And you identify as a male or a female?
Male.
Okay. And you have male partners, female partners, both?
No, female.
Okay. Any history of STDs?
No.
Okay. And you tell me about your living situation. Who do you live with?
My fiance.
Do you have any children?
Yes.
How many?
3.
Okay. Oh, you said you had a son. Yeah.
Yep.
You live in a home with your fiance. You feel safe at home?
Mm-hmm.
Any current stressors?
No.
Okay. And what do you do for a living?
I'm in construction.
Okay. Is that full-time, part-time, full-time?
Full-time.
Okay. Okay. Do you have any allergies to medications?
No.
Do you have any allergies to foods?
Nope.
Do you have any allergies to anything in the environment?
Just normal seasonal.
Seasonal allergies. Do you know specifically what that's from, like grass or ragweed or
Grass mostly.
grass? Okay. And how old were you when that allergy, when you first noticed that was an issue?
probably my 8, 9,
Okay,
something like that.
so young.
Yeah.
And are you on any medications? Any prescription medications?
No.
Are you on, do you take any vitamins or supplements?
Just normals. Yeah.
Like
Normal
a
vitamins. Just
multivitamin?
over-the-counter multivitamin, yeah.
Okay, and that's once a day? You're pretty
Once a
good
day.
about taking that?
Every day.
Awesome. Do you take any over-the-counter medications?
No.
Okay. Do you use any recreational drugs?
No.
Any history of hepatitis C?
No.
Do you smoke tobacco, e-cigarettes, vape, chew?
Mm-mm.
None of that?
No.
And do you drink alcohol?
Just maybe once a week, twice a week.
Once a week or twice a week?
Yeah.
Okay. Have you ever felt the need to cut back on your alcohol use?
No.
Has anybody ever suggested that you cut back on your alcohol use?
No.
Okay. And when you drink, is it beer, liquor, wine?
Just beer.
Okay, and how many drinks in one sitting?
1 or 2.
1 or 2 in a sitting, okay. And that's cans of beer?
Cans.
Okay. And what's your diet like? How many times a day do you think you eat? Are you on any special diets?
No special diet. Eat twice a day for the most part. Lunch and dinner.
Okay.
I'm not a big breakfast fan.
Okay. And do you drink caffeine?
A couple cups every morning.
Of
Coffee.
coffee daily usually?
Yeah, 1, maybe 2.
Okay. And do you exercise?
I wouldn't say regularly.
Okay.
Yeah.
With your job, that's probably got to be some exercise though.
Mm-hmm.
And how do you sleep at night? How many hours of sleep would you say you get in a night?
I sleep on my back and probably 6 to 8 hours.
And do you feel rested in the morning?
Mm-hmm.
Yeah. And vaccines, are you up to date on vaccines?
Mm-hmm.
Do you get your yearly flu shot?
Nope.
No?
Mm-hmm.
Okay. Do you know when the last time you had one was?
Couldn't tell you.
Okay. All right. I'm going to ask you some questions about different parts of your body, and you can just say yes if you're having any of these symptoms.
Mm-hmm.
Are you feeling fatigued, fevers, chills, nausea? No.
Nope.
Any head trauma or headaches?
Nope.
Any dizziness or problems with balance?
Nope.
Any changes in vision or discharge from your eyes?
Mm-mm.
Any ringing in your ears or ear pain?
None.
Any nasal congestion or nasal pain?
Nope.
Any difficulty swallowing or pain in your throat?
Mm-mm.
Any swelling or stiffness in your neck?
No, feel pretty good.
Okay. Any chest pain or chest palpitations, heart racing, feelings like that?
Mm-mm.
Any difficulty breathing, shortness of breath or cough?
Nope.
Any changes in your bowel habits from what's normal or upset stomach, stomach pain?
Nope, pretty normal.
Okay. Any difficulty with urination or pain with urination?
Mm-mm.
And then, do you have, besides the knee that we discussed, do you have any other joint pain or joint swelling?
No, not that I've noticed.
Okay. Any intolerance to like heat or cold that you've noticed, or change in how thirsty you are or how much you have to go to the bathroom?
No, pretty normal.
Okay. Have you ever had a blood transfusion?
No.
Have you ever noticed any easy bruising?
Nope, not that I'm aware of.
Not that you were aware of. Any history of depression or anxiety?
No.
Any thoughts of hurting yourself or someone else?
Nope. mental illness.
Okay. So now I'm going to do some testing to test your neurological symptom or system.
Mhm.
So I'm going to have you close your eyes.
Okay.
And you're going to plug one nostril. You pick a nostril and plug it for me.
Mhm.
And I'm going to have you smell this. What does that smell like?
Nothing. Oh, like cherry-ish, something or other.
Fruit. Okay.
Sure.
And then plug the other nostril for me.
Okay.
And then smell that.
Yuck.
Yuck.
Yeah.
What does it smell like?
Minty.
Okay. So that is cranial nerve 1, olfactory. We are not testing cranial nerve 2, which is optic. Testing visual acuity. We are not testing cranial nerves 3, 4, and 6, which is the extraocular movements. Cranial nerve 5 is trigeminal, so I'm going to touch the sides of your face. You're going to clench your teeth as hard as you can. No pain there. Okay, now you're going to close your eyes for me. I'm going to touch you, and you're going to tell me on your face where I touch you, okay?
My left temple. My forehead. My jaw. Temple.
Okay. Cranial nerve 7 is facial. I'm going to have you look directly at me and smile. Stick out your tongue. I'm going to close your eyes as tight as you can for me. I'm going to try to open them, and you should resist that. Okay. Puff out your cheeks. Okay. Cranial nerve 8 is acoustic. We are not testing the hearing, bone conduction versus ear conduction, testing like that. The next one is glossopharyngeal. I am going to have you open your mouth, and I would shine a pen light, and you want to say ah for me. Put your tongue down if you can. Say ah. Okay. That would be that the soft palate and uvula raises midline symmetrically. The next one is the vagal nerve, which we are not testing the gag reflex. The next one is the cranial nerve 11 is spinal accessory. I'm going to put my hands on you. You're going to try to shrug your shoulders. Shrug your shoulders. And then I'm going to put my hand on this side of your face. Try to turn towards the window. And turn the other way. Like, look sideways. There you go. And the last one is hypoglossal. I am going to have you stick out your tongue straight as far as you can. Just stick it out. And then one side, and then the other side. And tongue movements appear strong. There's no fasciculations. There's no deviation. Everything looks symmetric. So now I'm going to test your coordination.
Okay.
So I'm going to have you do what I do with your hands. You're going to tap your thighs this way and then tap your thighs this way and go as fast as you can. Your thighs. Yep. And back and forth. Good. Okay. Next, I am going to have you touch your nose and then touch my finger, and I'm going to be moving my finger as we do this. So touch your nose and touch my finger. And again, touch your nose, touch my finger, touch your nose, touch my finger. Okay. And we would do that with both of his hands. For the lower extremities, I'm going to have you take your feet like you're pressing on a gas pedal and go as fast as you can. Tap, 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 tap. Okay? And then I'm going to have you take one of your heels and take it from your knee down to your ankle, down your shin, and then the other one. Okay. Then I'm not going to do this because we have a very small room, but next I would test the gait, heel toe, walking on toes, walking on heels, looking for arm swing and making sure he's steady. And then I would have you stand up, and you don't have to go all the way down, but just do a little squat for me. Yep, knee bend. Go ahead and sit back down. All right, I am going to move around your arms and your legs and just let it, don't resist, just let it go easy. Okay. Leg. Okay. No resistance to passive range of motion. Motor. No. Muscle. Put your arms out straight for me. Push up against my hands. Push down against my hands. And then at the elbow, push against my hand. Push against my hand. And these would all be bilateral. And then at the wrist, push up. Push down. And then take your thumb and make like a hook with it. So I can get my finger in there, and I'm going to try to pull your thumb away. Keep resisting. Yep. So we did wrist, we did hand. Spread your fingers for me, and I'm going to try to push them together. You try to resist. Good. Bilateral, and then try to lift your thigh against my hand, and then push down. Try to kick out your leg against my hand, and the other direction. Try to raise your foot and push down. Bilateral. I'm going to have you stand up, stick your arms straight in front of you, palms down, and close your eyes. And I would stand close to the patient to make sure he doesn't lose his balance and we don't have a fall. So you would stick your arms out straight. And we would do this for 20 to 30 seconds. My next test is called the pronator test. I'm going to tap down on your arms, and once I tap down, just bring them back up to where they were. Good. All right, you can sit down. So we did Okay. I'm going to touch you with something sharp and something soft, and you're going to tell me which it is and where I'm touching you. And you're going to close your eyes.
Temple. Sharp. Soft. Something. My elbow.
What side?
My right. Something sharp on my left elbow. Something soft on my left knee. Something sharp on my left toe. Sharp on my right foot.
Good. Okay, you can open your eyes. I don't have a reflex hammer, so we're going to go through this the best we can. First, I would check his deep tendon reflex in his bicep by using my finger first, letting the patient's arm relax. And then I would tap into my finger to elicit the response. Then we would do the brachioradialis tendon reflex. I would find my spot and then again tap that and watch for the upward motion of his hand. And we're missing one. Oh, and then I would take the patient and you would just relax your arm in my hand. And I would tap behind the elbow and you would see the outward motion of the arm a little bit. And then I would test the patellar tendon, which is directly distal to the patella, just striking it directly with the hammer. And then I would dorsiflex the foot and strike the Achilles for that reflex. And that's all for deep tendon reflexes. Now we're going to move on to musculoskeletal. So first I'm going to start by inspecting upper and lower extremities, that everything is symmetric. There's no obvious joint deformities or swelling. The sound is on, right? Okay. Joint deformities or swelling. There's no drooping of either shoulder or hip that I've noticed throughout the assessment. And I'm going to touch, and if you feel any tenderness or anything like that, just let me know. Sternoclavicular joint down the clavicle, acromioclavicular joint, coracoid process, subcoracoid bursa, subdeltoid bursa, trace along the back, along the scapula to the acromion process, and from the posterior aspect, the supraspinatus, the infraspinatus, and the teres minor. No tenderness. Okay. Bilateral. Oh, and the biceps tendon. Then I would feel your elbow, your medial epicondyle, your lateral epicondyle, your olecranon process, and your ulnar nerve along the medial aspect. And then the radial styloid, the metacarpals, 8 metacarpals. No, 8 carpals, and then metacarpals, and then the MTP joints, and then the medial and lateral aspects of the PIP and DIP joints on each finger. No pain. Okay. Bilaterally. Next, I'm going to test the range of motion. I'm going to have you stand as best as we can in front of the camera. So I'm going to have you flexion, raise your arm forward, extension, your arm behind you, and then abduction, take your arm away from you, adduction, bring your arm in front of your body, all the way across your chest. Good. And then bring your arm to a 90-degree angle and flip your palm forward. And then take the same hand behind your back and reach above your buttock. Oh wait, no. Reach your scapula. Yeah, sorry. Okay, you can sit now. You are going to extend your elbow, flex your elbow. Okay. You're going to stick your hand out and then take your wrist, invert your wrist, yep. And take your fingers all the way up and all the way down. And spread apart your fingers. Bring them back to the middle. Take your thumb and touch your pinky tip. And then touch the other tips of your fingers. Bring it back to the pinky. Slide it across your palm. Slide it back. And then put your palm together. Bring your thumb, abduct your thumb all the way out, and then adduct your thumb back in. Good. I'm going to have you stand and face me. Kick your leg. This is hip range of motion. I'm going to have you kick your leg forward and backward. Okay, and then kick your leg laterally outward to abduct, and then bring your leg across your body for adduct, and then your knee, flex it up, extend it back out. Sit one more time for me. I'm going to stabilize him by the hip, or by the calcaneus, and internally and externally rotate at the knee. And I missed this one, but I'm actually going to just lay down. Okay, so this is for hip inversion and eversion. I would have it just relax in my hand, and I would internally rotate the hip and externally rotate the hip. So we did hip, we did knee. If it's gonna see me. And then point your toes, or point your, gas pedal up and gas pedal down. And next I'm gonna take your ankle and invert and evert. And then I'm gonna take your forefoot and invert and evert. And then each toe up and down to make sure there's range of motion. And I would have also inspected the lower extremities. I think I already said that. For body position, back on neurological, I would have explained that the patient, or view that the patient has no fasciculations, he has an upright body posture, no tics or tremors. So we did strength, we did range of motion. Okay. I'm going to have you sit back up for me. Next, I'm going to inspect the patient's skin. There are no localized areas of erythema. Will you scoot down? No localized areas of erythema. I would look into the patient's conjunctiva to make sure there's no jaundice in the back of his mouth, no other signs of jaundice. I would pay attention to the lips and extremities, fingers, toes, for signs of cyanosis. And there are no areas of pallor head to toe. We're not checking scalp, inspecting or palpating the scalp, but I would inspect the scalp and hair texture. There are no areas of hypo or hyperpigmentation. No lesions. If there were lesions, I would inspect, or I would assess the size, character, location, color, those things. If there were any nevi, I would assess A, B, C, D, E for signs of skin cancer with those. I would inspect his nail beds. His nail beds are smooth. There's no cracking. They're pink. Capillary refill is brisk. Same thing with the toes. I would inspect those nail beds. No discoloration. I would palpate his skin for temperature. He is warm throughout from head to toe. No areas of coolness. Moisture. The skin is dry. The texture is smooth. No tenting and testing with skin turgor, bilaterally, everything. And then I would palpate the nail beds for any tenderness. And When I palpated his feet for the musculoskeletal, I forgot to go in between the MTP joints for tenderness. That is all for skin. For mental status, throughout this exam, I would have noted that my patient is alert. What's your name?
Andy.
And where are you right now?
In the office room.
That's wrong.
Exam.
Exam room. And do you know what month this is?
Yes.
And what month is this?
It's April.
And when's your birthday?
Yesterday. The
Which-
7th.
April 7th. Do you know what you had for lunch?
I didn't have lunch.
What did you have for breakfast?
I had a shake.
And then I'm going to tell you 3 words to remember.
Okay.
And we're going to come back to it a little bit later to see if you remember that.
Mhm.
Number 1 is going to be frog.
Mhm.
Number 2 is going to be drink.
Mhm.
Number 3 is going to be green.
Okay.
Okay? And I'm going to have you... Oh. I would have noted that his speech is fluent. It's appropriate speed and volume. There's no stuttering or rushing of his words. And I'm going to point to, what is this?
About you?
Yep. And what is this?
A radio?
And can you spell the word world backwards?
Maybe.
Try it.
D-L-R-O-W.
Good.
Yeah.
Yeah. And what were those 3 words I told you?
I already forgot. Frog. Something. I have a bad memory.
Frog, drink, and
Drink and I can't remember the third one.
green.
Yeah, green.
Okay.
I have staple though.
Yes. The patient's facial expressions are calm and smiling. His affect is neutral to warm, cooperative. He has appropriate insight and judgment. No hallucinations or delusions. No obsessions, compulsions, or phobias. His body posture is upright. He's appropriately dressed for the situation and the weather. Hygiene is kept. I'm going to take this right here. And if you could draw a clock on this page for me. With numbers.
It's not to scale.
It's pretty good. Picasso. What is 10 plus 10 plus 10?
30.
What is 25 times 4?
100.
Okay. And if I told you, what?
No.
If I told you to kill it kills 2 birds with 1 stone, what does that mean?
1 stone kills 2 birds.
Kill 2 birds with 1 stone?
You killed 2 birds with 1 stone.
Figuratively, what does that mean?
Oh, you did 2 things at once.
Okay. That is all for today's examination. Thank you, Mr. Scarn, for coming in today.